नमामि धन्वन्तरिमादिदेवं सुरासुरैर्वन्दितपादपद्मं लोके जरामृत्युनाशं दातारमीशं विविधौषधीनां शङ्खं चक्रं जलौकां दधतं मृतघटं चारुतोर्भिश्चतुर्भिः सूक्ष्मस्वच्छादिरुद्यं शुकपरिविलसन् मौलिमं भोजनेत्रम् कालाम्बोदोज्ज्वलाङ्गं कटितटविलसत् चारुपीताम्बराढ्यं वन्दे धन्वन्तरिन्तं निखिलगदमिव प्रौढदावाग्निनीलम्।
Namaste to all of you. Just welcome. I think Dr. Vandana Pathak as well as Dr. Silpa Yerme is here, and I hope that our today's expert is also present here. So welcome to Ayush Darpan Journal's platform, and the topic is Black Fungicide with Perspective. Before I welcome to you, I hope that Netrayu Hospital, I think, is. I hope that मैं पहले आपको होस्ट बना देता हूँ मैडम जी, आप फिर जिसको चाहें उसको आप होस्ट बनाएं जी। ये लीजिए, होस्ट हैं आप मैडम, आप अनम्यूट करिए, मैडम।
यस।
वंदना मैडम को भी
गुड आफ्टरनून
होस्ट
एवरीवन।
बना दीजिए।
तो हाँ, यस बना देती हूँ। यस, गुड आफ्टरनून एवरीवन। आज के इस सत्र में आप सभी का बहुत बहुत स्वागत है। विक्टोरियस सीरीज ऑफ आयुर्वेदा, ये सीरीज हम काफी लगातार कई महीनों से चला रहे हैं। तो आज के इस स्पेशल सत्र में विक्टोरियस स्टोरीज ऑफ आयुर्वेदा के जो आज के हमारे वक्ता है डॉक्टर हेमकांत बाविस्कर सर, जो कि नेत्रायु चिकित्सालय जलगांव महाराष्ट्र से है। सर काफी सालों से नेत्र रोग में आयुर्वेदिक एप्लीकेशन के बारे में कार्य करते हैं। हमारे साथ है वैद्य नवीन जोशी सर, जो कि फाउंडर है आयुष दर्पण फाउंडेशन के। हमारे साथ है को ऑर्गेनाइजर वैद्य वंदना पाठक मैडम, जो कि कानपुर लखनऊ उत्तर प्रदेश से है। तो इस प्रकार से जैसे कि इस पैंडेमिक को लेकर अभी तो थोड़ा मतलब कम हो गया है, बट म्यूकरमाइकोसिस एक नया जो डिसीज हमारे सामने आया है, इसको लेकर चिंता भी जताई जा रही है। और इसी को देखकर आज के इस विशेष सत्र में सर नेत्र शल्य चिकित्सक है, फेको सर्जन है। तो सर आज के इस सेशन को आगे प्रस्तुत करेंगे। तो सबसे पहले मैं हमारी सहयोगी डॉक्टर वंदना पाठक मैडम से अनुरोध करती हूँ कि वो सर का परिचय करा दें।
नमस्कार जोशी सर, शिल्पा मैम, और आपका स्वागत है डॉक्टर हेमकांत शिवाजी राव सर। आई एम गोइंग टू इंट्रोड्यूस डॉक्टर शिवाजी Rao Baviskar sir, and before that welcome all the audiences. As you are now well known, you very nicely know about Ayush Darpan and Victorious Stories की जो एक वो श्रृंखला चल रही है, उसी में हम डॉक्टर हेमकांत शिवाजी राव, जिन्होंने आंखों के ऊपर बहुत नेत्र चिकित्सा ऑप्थेल्मोलॉजी पे बहुत सारा काम किया है, उनका मैं इंट्रोडक्शन पढ़ने जा रही हूँ। और मुझे उम्मीद है कि आज का सत्र हम वैद्यों के लिए बहुत ही लाभकारी होगा। सो ओवर टू इंट्रोडक्शन ऑफ वैद्य हेमकांत शिवाजी राव सर. So Dr. Hemkant Shivaji Rao Baviskar sir is a very young, enthusiastic and and a very expert ophthalmic consultant. He is practicing since 25 years and heading Nitrayu Ayurvedics. उन्होंने बड़ा अच्छा नाम रखा है, Private Limited at Jalgaon. His specialized field is phaco technique. Apart from this, he is a visiting consultant regularly on every last Friday and Saturday in last 15 years as Ayurveda ophthalmic consultant at Pune. And he's also giving his services in Mumbai. This is for the kind information of the audiences so that they can contact him and take his sevas. He's a founder member of NIMI Eye Care Treatment and Research in Ayurveda. He's working with Netra in Pune, which is a unique super specialty eye care center, ideal integration of modern ophthalmic techniques with assuring treatment modalities of Ayurveda and yoga. Except surgery, all treatments are with Ayurveda modalities, that is oral medication, Netra Karma, that is the eye techniques which we are using in Ayurveda, like Tarpan, that is putting off ghee in the eyes, Vidalak, applying lape around the eyes, Rakta Mokshan, bloodletting to remove impure blood from the side. In today's scenario, his main focus is to treat the critical eye ailments by Ayurvedic medications and techniques. Today, the burning problem is mucormycosis. Though mucormycosis is rhinocerebral, pulmonary, cutaneous, gastrointestinal, disseminated, but since his field is ophthalmology, so he will be discussing about the Nidan Chikitsa and the limitations of mucormycosis in his own specialty. So here we go over to Dr. Hemkant Shivaji Rao. Please do share with your ophthalmologist friends of modern pathies as well as Vaidyas, and I think his session will be a burning candle for all the Vaidyas who want to expertise and do practice in this field. Welcome, sir.
Yes, welcome. Thank you, madam. Yes, can I share my screen now?
Yes, sir.
Hello,
Yes,
I am audible?
yes, you are audible, sir. You can share your screen.
Okay. Madam, where is the icon? I am going to share that.
Green, sir, there is an option,
yes,
share
got
screen,
it.
green.
Yes.
आपकी PPT open है, sir? Whether it is open in
Yes,
desktop?
it is open.
Okay.
उसको close करना जरूरी है?
नहीं,
Yes.
आप जैसे चाहे, ऐसा कुछ नहीं. PPT is not necessary. You can continue with your verbal information.
So, thank you to Ayush Darpan, especially Naveen Joshi sir, Shilpa Erme madam, and from UP especially. It is a pan-India presentation. Vandana Pathak madam from Uttar Pradesh. So, today, we are going to present this mucormycosis. So is it okay? So welcome to all the viewers and Ayush Darpan members and subscribers. Now, you know the pandemic conditions of COVID-19 and after effects of the COVID-19. And all are you aware about the COVID-19 complications. But one can handle all the complications except mucormycosis. Why? Because mucormycosis is a burning for the patient, burning topic for the Vaidyas, doctors, surgeons, and everywhere, pan doctors. Why it is so? Because it is a life-threatening problem. It's a life-threatening problem. Previously, this mucormycosis is not so common like in this after COVID-19. So only one ENT surgeon in his career of 30 years, saw only 2 to 3 cases. So routine ENT surgeons and other these surgeons can't routinely operate this process or these problems, or not facing this in day-to-day practices. So everyone is frightened that they are not day-to-day patients are like that mucormycosis. So what to do when the patients are coming in so numbers? So that's the problem. So everyone is, there is no drug like that remdesivir. Here is also the problem of amphotericin B, because anyone don't know what the complications of COVID-19 we are going to face. That's why these problems are there. So in the world, you can see there are very few cases in other countries of mucormycosis. So in India, why it is there? So much cases, why it is there? So we can see the causes of mucormycosis and the ongoing treatments by modern science, and what about the Ayurveda fraternity. So today I will present four ongoing patients which are treating at Netrayu Hospital. I am presenting that pre and post evidence base, and it is completely by Ayurvedic treatment only. So in my 25 years career, I am also one of the members like others that I am also not aware about the mucormycosis and what is the problems. So everyone, Vaidyas and the doctors know the mucormycosis, where it is and what the problems facing by the patients, and the treatment modalities in the modern and Ayurveda. So just I talk the facts about the mucormycosis. Very rarely found before COVID-19 pandemic. Hardly 1 to 2 cases in 30 years of practice of ENT surgeon. The differential diagnosis is confirmed by punch biopsy only. Say the KOH titration is also done for the confirmation, but punch biopsy is a gold standard confirmation test. So why threaten? The mortality is more than 50%. More than 50%. That's why the mucormycosis is in the limelight in the medical field. That's why everyone is talking about the mucormycosis. The main line of treatment in the modern is the debridement, that is surgical, and antiviral, that is medical treatment. And what is the role of Ayurveda in this? As you know, in severe cases, the death rate goes up to the 50 to 85% of patients due to angioevasion. So angioevasion, it is goes in the kidney, lungs, hearts, and brain. So it's a duty of Ayurveda also to give the treatment of such patients to, it should not be deteriorate further in their stages of mucormycosis. I feel the Ayurveda has a very great role in that. After seeing the 4 patients, the treatment is ongoing now. After angioevasion of the blood vessels, it is found in the brain, heart, kidney, and more likely in the lungs. See where the mucormycosis lies. The mucormycosis lies in the sinuses, at dental area, palate, eyes, and in cavernous sinuses. These are now the main spots where we get the problems. So it's in modern, it's a team of doctors working on this. That is ENT specialist, ophthalmologist, dentist, oral surgeon, neurologist. This team is required for the treatment. And when I forget that the physician, which has a very great role, that the antiviral drug amphotericin B, it should be under medical supervision because it is so much toxic. Around 30% of the patients are going towards the nephrotic syndrome, or it is a nephrotoxic. So physician means all the community is come under these patients treatment area. Above all, subject in Ayurveda comes under the Shalakya. This is the vision of Ayurveda Acharya. They explain the Urdhva Jatrugat Roga as a separate, and there is no entity like a dental, ENT, and the eyes and the brain. So it comes under one roof. So one Ayurvedic doctor can handle these all the cases, or the Shalakya specialty doctors can handle these all at the one site, under one roof. But we cannot means expose like these conditions to handle this, because Ayurveda is in surgery, it is not in a very good phase. That's why the modern peoples are doing all this. But see the vision of our Ayurveda Acharyas, these all the problems comes under the Shalakya. This is the vision of Ayurveda. They know the interconnection of these specialities. So when we have a problem about the nose, you can also see the problems in the eyes. You can see problem in the throat simultaneously. So only one doctor, Shalaki, is the handling these all the cases, not the separate specialties. So going towards directly the mucormycosis sites, you can see this figure on the sinuses, eyes, in the dental frontal area, and in the head. These are the sites where it's rise. Going towards the directly on the mucormycosis. So how mucormycosis is formed in these patients? Which patients is probably have to this infection? So it needs humid environment to grow. You all of Vaidyas and doctors are aware that the anaerobic respiration, the fungus needs this to grow the growth. So it's a favorable condition for black fungus or any fungus. There is a lack of O2 where the fungus grows. So about the sinuses, why it is come from the sinuses? Because it needs the space first to grow, but it should be exposed to the outer environment. So nose and the sinuses are the direct open area that where we got the infection. So closed ostium of sinus. So the maxillary sinus, it comes direct contact in that. So it starts, the disease starts from there. So the dangerous of the mucormycosis means it is a very threatening disease. So the base of that mucormycosis is invade the all mucus and the bones also. Is a characteristic of this mucormycosis. So what happens with the closed ostium sinus? Due to steroid and inflammation of the tissue, it causes to close the ostium, and that causes closed chamber, that is less O2. So there is no any ventilation between the nose and the sinuses. Due to the steroid use and the COVID-19 inflammatory, post-inflammatory, post-COVID-19 inflammatory conditions, the ostium is closed. So indirect exposure, this is the direct exposure. So when there is anaerobic respiration, the maxillary sinus is closed. And from the blood, you know, the SpO2 concentration, O2 concentration in the blood is reduced in the COVID-19. So less immune patients like diabetic and other patients, there is a lack in O2 in the blood, but they are not facing before this pandemic. The cases are not that much because diabetes is there before this, but we don't see these cases before this. So these are the two conditions: closed ostium and the drop SpO2 levels after COVID-19. So from the blood supply, there is a lack of O2 supply to that maxillary sinus tissue, and ostium is closed. It makes a chamber moist, and the environment, it is hot. So fungus need this hot condition and the lack of O2. These are the two peculiarities where the fungus grows. So closed air, lack of O2 from blood environment, and steroids, stagnation of water. This causes maxillary sinus are more prone for this. So this is the condition where the mucormycosis gets to start from here only. So directly go to the COVID-19 patients. So why COVID-19s are only complications with mucormycosis? There are the patients of COVID-19, they are quarantined at home, hospitalization of the patients. These are the two categories. But I saw one patient in my OPD, just treatment is going on, Ayurvedic treatment is going on for that. He didn't receive any Fabiflu and steroids. He received the homeopathic treatment for that at home. He is diabetic and his COVID-19, the positiveness is totally cured by the homeopathic medicines within 7 to 8 days, and he has no any complications of O2, and the SpO2 level is also normal for that patient. So this patient is quarantined, didn't have the Fabiflu and the steroids in that. Still, he got the mucormycosis. This is very dangerous sign for me and all the fraternity, that how he gets the infection. At home, he didn't use the mask also because he have the special room at home. So the more for the quarantine patients, means the 99 patients received the Fabiflu and the steroids and homeopathy and Ayurveda treatment also. Each COVID-19 patient should watch despite of admission in the hospital, but receives this Fabiflu and the steroids. So for the quarantine patients, the risk of mucormycosis is 10 to 20% only. Why quarantine patients is prone for this? Why we get the quarantine patients mucormycosis? Because they may have the immune compromises problems, or the old age disease, or the old age itself. These are the reasons for that. So the causes for the hospital. So these are the quarantine patients, how they face it. So everyone, Vaidyas and doctors, and at home also, you should tell your patients for the mask they are using continuously in a day. So that should be a one factor, that they are unhygienic mask using whole day. So ask the patients to use the new mask after 3 hours or 4 hours. So what happens for the mask? There is a condition like a maxillary sinus. We explained already. So in hospital patients, COVID-19, the diabetic, already low immune, unhygienic O2 supply by pipe ventilator, this is a source of contamination. So they received the remdesivir, steroids, and toci. These are the immunosuppressive. Not there is a supplement. This is the wrong one. Immunosuppressive drugs they are received. So it is a remdesivir is not a major risk, but steroids and toci is the who received this. They are more prone to have this mucormycosis. This is a major risk factor. So out of 10 patients, 8 patients are 90 to 95% of the patients who received the steroids, toci, and having a diabetic. You may get this history from the patient. So factors of MIM. The complex factor, pre-existing disease like a diabetic mellitus, use immunosuppressive therapy that we discussed for the COVID-19 therapy, use risk of hospital acquired infection. That mask, O2 mask is used at hospital. They are not using the water, purified water or the distilled water, and the tubing and the mask, it is not totally it is not disposable. It is used patient to patients. So there is a risk for the hospital admitted patients. Steroids, the mean duration between the diagnosis of the COVID-19 and the development of the symptoms of mucormycosis was 15 to 6 to 9 days. Means after discharge of the patient, you may get 6 days, means 21 days, 20 days, 15 days, or 10 days. You may get these mucormycosis infections triggered. Means at the first day, he may develop these mucormycosis symptoms. So where the route of entry of this mucormycosis? The route of entry is inhalation, ingestion, traumatic inclusion. And what is the pathophysiology for this? This is the angioevasion, vessel thrombosis, and the tissue necrosis. Why it is danger? Because it invades the bone and invades the angios, means vessels, blood vessels, and it goes directly pour into the blood. So that's why it is a life-threatening drug. So vessel thrombosis is occurred, and all the remaining part is necrose. Due to the vessel thrombosis, there is a tissue necrosis. This is the pathophysiology of this. So the debridement is the main treatment for this. In this, in fact, slide, you may see this is the hospital acquired infection. In the first slide, you see there is a change in environment. Foggy is there. There is some droplets are also there due to the reuse of the mask, and they may cause this infection. And the second one is the disposable mask. You can see very clean, and that reduces the risk of mucormycosis. So going towards the symptoms, mucormycosis is directly related to the nose, eyes, teeth, brain, and the palate. Palate is also may hampered for this. Onset with nasal stuffiness, black necrotic scar on the nasal terminates or palate, very characteristic. This is the sign of this. Epistaxis may occur, that black blood may be come from the nose. This is one of the sign. Facial pain, lateral eyes redness, means you get in lateral condition, there is a redness, proptosis, chemosis, and ophthalmoplegia, double vision, and diminished vision. I have ongoing treatments for these patients. They have the double vision, they have the proptosis, they have the lag ophthalmos, means closed eye. So in that lag ophthalmos, the patient didn't get the double vision because he is able to see the one eye. With one eye, it is very clear. But in ophthalmoplegic cases, when the eye movements are totally stopped, then you get the double vision or diminished vision. And in the brain, cavernous sinus thrombosis, you get the multiple cranial nerve palsies, visual loss, especially by the central retinal vein occlusion. CRVO is the condition where you get the acute loss of vision. That is condition of CRAO, central retinal artery occlusion. When the blood vessels are involved in this and the spread is throughout the body. Frontal lobe abscess, carotid artery or jugular vein thrombosis causing hemiparesis. These are the complications of the mucormycosis in later stage. You see the sites of the mucormycosis and the stages of mucormycosis where the mucormycosis is present. When it is present at the palate, you should debride all the palates which is totally gone, and when the eye tissue around the tissue, eye tissue is also totally hampered, then enucleation is required for that. So the life-saving surgery is the debridement of the whole mucormycosis where it grows. It grows from the sinus, eyes, in the all sinuses, ethmoidal, palate, dental area, all are removed by the surgeons. You can see on the right side the very worst case of the mucormycosis. The diagnosis is done by the CT MRI paranasal sinuses, orbit and the brain. Functional endoscopic sinus procedure which confirmed mucormycosis on histopathological examination. So what is the main diagnosis is the only the tissue, histopathological tissue is the main, means punch biopsy is the main. But after punch biopsy, you may get the report after 7 days. So KOH titration is done where the which hyphae is present in that, where is the septate hyphae or non-septate hyphae. The septate hyphae is the other fungus, and in mucormycosis there is a non-septate hyphae, so it grows very fast within a 20 to 30 days. You see this MRI sinus orbit. On the right side of this, you can see the left side, but the patient right side, it is the right maxillary sinus where you see the growth of the mucormycosis, and it invades the inferior roof of the eye and going in retrobulbar towards the eyes, and all the muscle restriction due to the invasion of the eye retrovulvarly, so all muscle reaction, all the muscle movements are stopped. So there is ophthalmoplegia. It may be bilateral or it may be unilateral. Where the mucormycosis grows, that side is hampered by the tissue. So you may get only one eye infection by the mucormycosis also. So in this slide, you see there is the superior orbital bone. It's also having a problem that there is also invaded by the mucormycosis. You see the chemosis, means cornea is embedded totally by the conjunctiva because there is a chemosis. So we see the lid edema and the chemosis. It's a peculiar signs. No movement of the eyeball, brick red eyeball. This is the typical condition of mucormycosis, and double vision. The throttling pain on that lateral side of the face. These are the peculiar signs. And the treatment. So why it is a 2020 match, not like a test match? Because time period available is only like a 2020. Because you have to go very intense treatment as a medical treatment and the surgical treatment. It's a lack of, means 1 day, 2 days, 3 days, like that COVID-19. You don't know when angiovention is at any time. It may occur and patient land into the other body infections. So that is a life-threatening. So patient is totally admitted in the hospital under observation, and whatever the present of the patients, where the location is, and from there the treatment is started. So in these patients, the decisions are, it should be a very fast, because there is no any time at the mucormycosis. Don't give the time to you think for that what the treatment is. You do the diagnosis, you do the MRI, you do the CT scan, how much the mucormycosis is present in that area. So you call that super specialty surgeon, means ENT, eye, neurosurgeons, or the dental surgeons, or the palate or mukharog surgeons. So after the diagnosis, the treatment start very early. So in modern science, confirmed diagnosis by punch biopsy, in the surgical treatment, debridement in early stage. But before debridement was well done, so patients should start the amphotericin B. Why? After debridement, angioevasion may be there, and it goes towards inside the body. The secondaries may go inside the body, and the sepsis of this mucormycosis may be there. So, the contamination should not be all in the body through the vessels. So first they are start the amphotericin B first, then debridement was done. But after debridement, on that day, the amphotericin B should be given by IV means. After availability of antiviral, mild cases, drug for the mild cases, only amphotericin B can be given. Nowadays, scarcity due to the sudden rise in there is a lack of, means there is no market drugs is available in throughout the country. This is the means mild case. So you go for the debridement and the amphotericin B. Any advanced case, it invades the blood, it invades the total eyeball, it invades the total upper jaw, teeth, eyeball, sinuses of the bones, nasal bones. So radical debridement means total that area is debrided, and the amphotericin B, this is the treatment in advanced cases. When only medical treatment was done, fungus is in blood, angioevasion, so only medical treatment is done. Injection amphotericin B, mortality is very high. 50 to 75 injections may required for this patient to save his life. And the cost of this is around 4,000 to 7,000, depends on the cities and the availability. And what the prognosis? So I already told you that mortality is high even if treatment was done. In mild cases, the mortality is 30 to 50%. Moderate to advanced, the mortality is 50 to 80%. And when it is in throughout the body or in the lungs or the brain, when its mortality goes 100%. So up to this presentation, what are the key factors? The key factors in this up to the presentation, the early diagnosis and the treatment are essential to prevent further end organ damage. So, and no angioevasion should not occur. These should be kept in the mind. These are the references where I got these presentation points. So keep in mind, friends, that it is very important. Mucormycosis needs surgical intervention in moderate and severe stages, but needs supports from Ayurveda. See, it is very important. Why Ayurveda support needed? In severe and moderate conditions. In early conditions, you may get the result by Ayurveda only. We'll go further. In the presentation, you see the only Ayurvedic treatment is given at Netraya Hospital and the patients are totally okay. So it needs support of Ayurveda to reduce the rate of mortality. Except early stage can be treated by Ayurveda. So it's a 2020 match. We have no time to think for that, and the drugs which gives the results, it should be in 3 hourly, 4 hourly, 5 hourly, as per the condition of the patient. You know, the post-COVID patient, when come in your OPD, its SpO2 may be normal, maybe in between 85 to 90, it may be between 90 to 95. So these post-COVID-19 complications, the patient loses its bala, sattva and oj. You see the hospitalized patient when come to home, it requires 1 month, 2 months or 3 months to get back. So when such a patient exposed to the mucormycosis, so we should think for the Ayurvedic treatment. But why Ayurveda treatment? So to reduce the mortality rate or to reduce the amphotericin B complications or the toxicity of the amphotericin B. So you should think, every Vaidyas should think for this. But before going towards the treatment of mucormycosis, point to be think is the bala, sattva and oj. These are the major factors when we give the treatment to the patients. Because after the COVID-19 treatment, patient bala is very less. Sattva is also very less. It is very frightened. It is mentally disturbed. And when he comes, you see the oj of the patient directly. So in Pravara, you may give the Shodhana, Shamana and the Rasayana treatment for the patients. And the Avara Sattva, you should not use the Shodhana, because in one Virechana or one Basti, you may land into the complications because there is a lack of Bala, Sattva and Oj of the patient. So you should think for the proper dose of the Ayurvedic treatment and what dose should be these low Bala patients. In Pravara Sattva and Uttama Bala, you may give Shodhana, Shamana and Rasayana directly. But in Avara Sattva, only Anulomana and Shamana you should think for that. When you get back the patient Sattva and Bala, after that you may give the Anulom, Shodhana, Virechana and all these Panchakarma process you should add. But within a 20 to 40 days, you should totally monitor this patient, or your line of treatment should be very accurate, because otherwise the patient may land in the complications and the legal matter will be faced by you. So these are the conditions. So Ayurveda treatment, when the patient having a less Bala, Sattva and Oja, so if there is a good Bala, Sattva and Oja, you should use Shodhana as per doshas, Panchakarma, Shamana, Rasayana. In moderate, only Koshta Shodhana you should use, or Anulomana you may use, Shamana, Rasayana. In mild conditions, in mild Bala, Sattva and Oja, only Anulomana, Shamana and Rasayana. So why Ayurveda for mucormycosis? So post-COVID-19 need prevention of mucormycosis. So everyone, you Vaidyas are doing a very great work for the prevention of not only the mucormycosis, but all complications of the post-COVID complications. We call it as a post-COVID complications. There are clinics. They are advertising like that we're treating the post-COVID complications. So need to prevent the post-COVID complications, and mucormycosis is one of them. So why Ayurveda? The immune modulation treatment in all post-COVID immune compromised patients. So only Ayurveda can give this. No any pathy can give this treatment for the immunomodulation to prevent the mucormycosis. So post complication of COVID-19, to increase the immunity, the Ayurveda have a very great role. Unlike identity due to the rasayana, so modulation of the immune system and the rasayana means there is no any branch in the other pathies that like rasayana, there is no any medicines are like rasayana we will give to the our patients. So Ayurveda is most important for the mucormycosis and post-COVID complications. The role of Ayurvedic RX means treatment in mucormycosis. So it is a very complicated to give or to think for the line of treatment due to various stages of mucormycosis, mild, moderate, and the severe. High mortality rate. Like a 2020 match, within a time frame, you have to treat the patients, and patients means you should get out the patients from the mucormycosis. There is a very less time. In severe decrease in due to the oja, that is mental mana and sharira bala. So it is very complicated to give the treatment for these patients. And what should be the line of treatment in this? So it is very difficult to treat by the Shodhana treatment. So you should think for the Shamana treatment first when patient will come. If patient having a good Pravara Sattva, Oja and the Bala, you should go the Shodhana directly. But we will see the stages of the mucormycosis by Ayurveda, the thinking of process of the Ayurveda, the diagnosis process of the Ayurveda. So you should think for the Shodhana and Shamana, which patient you should give the Shodhana and Shamana. The stages of mucormycosis is like Amavastha and the Pakvavastha. So chance of Ayurvedic treatment in for the prevention for mucormycosis post-COVID in suspected cases of mucormycosis, it should be a close wash, everyday wash should be done, and punch biopsy may needed in the suspected cases, or when you give the treatment for the suspected cases, but it is not a mucormycosis, still you give the treatment in the suspected cases. And in early stage, you know the patient having a mucormycosis, but in early stage, you can, or the diagnosed patients, or there is a mild case, you can give the Ayurveda treatment only. But you should see the patient by all the Ayurvedic means or Ayurvedic diagnosis. Don't force patient for only Ayurvedic treatment. It should be may go into the legal matter. The Shamana, Ayurveda plus modern, you can suggest the patients for the Ayurveda and modern in moderate and severe cases. Early stage, you may give the only Ayurveda treatment, but it should be under observations. Keep in mind, this is most important. Every day or after 2 days, you should be contact in the to the patients. So how the response of this our treatment to the mucormycosis. In moderate severe cases, why Ayurveda treatment is there? To reduce the rate of mortality, Ayurveda treatment should give every Ayurvedic practitioners. But about the medicine, Ayurveda plus modern in severe cases, moderate or severe cases, and the surgical, it is a surgical debridement. This is the portfolio for the moderate and severe cases. You should insist the patient to have the Ayurvedic treatment because the diagnosis, the means the action of the Ayurvedic treatment is very, very different than the modern treatment. So you may told patient that your sattva, your bala, and your every part, your COVID-19 complications will suppressed by Ayurvedic treatments. In severe to advanced cases, so what should be done? So it is the chance to survive the patients, to reduce the rate of mortality. It is in bloodstream, ultimately goes goes to the patient towards the modern science because it is in emergency conditions. But patient desire for Ayurveda, then you can give the Ayurvedic treatment for this. So now the mucormycosis, how Ayurveda see this mucormycosis by the diagnostic point of view. In Nasa Roga, you may compare this diagnosis to the Dushta Pratishtha, but it is Krucha Sadhya. Means it is in moderate stage. In Sannipatik, it is Asadhya, a advanced stage. Sannipatik Pratishtha. In Netra Roga, Akshipak or Rakta Abhishanda, that is in moderate stage. You see the lakshanas of this Akshipakate and the Rakta Adivant. So these are the Netra Roga conditions we can diagnose. In Akshipakatya, you see that is called the end ophthalmitis in the modern science. All the symptoms and signs are the same as Akshipakatya in the Ayurveda in Netra Roga. In Danta and Talu, in Danta Vidhradi, this is in, we can find this in a moderate stage. And in the Talu and Danta, you may have the diagnosis like a Sushira and Mahasaushira. We call as a Talu Put or Talu Vidhradi. The treatment of the mucormycosis by Ayurvedic point of view, you should have the Kaval Gandush Nasya, Nasya, and in Netra, Seka and Bidalaka. These are the local treatment which will think for the patients. And in Shodhana, Panchakarma, as per Bala, Sattva and Oj. Every Vaidya can think as per Bala, Sattva, Oj, which Anuloman or Virechan should be given in this type of patients. And Rakta Mokshana is a key in this treatment. By Jalavukavacharan in mild cases or Siraved in moderate and severe cases, you may do the Siraved. And in Shamana, Tikta, Shita and Katuras should be used. The Tikta Rasa, Shita Virya and Katu Vipak. The Dravyas you can choose as a Shamana Chikitsa. That should be the Tikta, Shita and Katu. As going towards the diagnosis is a Dushta Pratishtha. So ignorance of all Pratishtha causes various further complications. So why Dushta Pratishtha? When we compare the mucormycosis in maxillary sinus, you may get the symptoms like this. Jwara is there in initial stages. Agnisada is there. Swasa Kasa, it is due to the COVID-19 complications are there. Uro Vedana, Parshva Vedana in face area. Mukha Durgandhya, Shopa, Puyopama, Sita Raktagita Shleshma Sansruti. Means mucopurulent discharge which resembles having whitish and red clotting, or otherwise a black blood through comes from the nose. Dirga Snigdha Sita Anukrumi. So Krumi condition may get after in advanced and late stage. Tiny whitish, glossy, long worms, maggots may formations will be the signs of this Dushta Pratishtha. So if you not treat the early stage, so Upadrava, when there is a numbness in nasal area, you see there is a numbness in the Kapola Pradesh. So in maxillary area, you see the numbness. There is no sensation. No sensation of smell. You know these all this. Drushti Ghat and other eye problems. Means I already told that CRAO, Drushti Ghat, when it is a Upadrava of the Pratishtha in mucormycosis. Means there is a condition of CRAO, central retinal artery occlusion. So Drushti Ghat is there. Kaf, Agnimandya, Shota, and these all like the Raja Ekshma when there is a we called the symptoms like Rajashma. In Talu Pradesh, you may see what the Ayurveda Acharya said in Susrut Nidan Sthan and Vagbhat Uttar Sthan. Puya Sravi Maharuja means pain and pus discharge or blood discharge from that site directly. So this is the palate area. When you have the mucormycosis as palate area, this is the diagnostic view by Ayurveda. And the treatment for the Talupak, it is explained in Susrut Chikitsa Sthan and Vagbhat Uttar Sthan. Acharya diagnosed these conditions in two ways, is in Avastha, Apakvastha and Pakvavastha. So in Talupak treatment or any treatment given by Ayurveda, first you diagnose the Avastha is Apakvavastha or Pakvavastha. When you go for the thing for the treatment, predominantly Pitta Shamana in the Talupak treatment. In Apakvavastha, rubbing using paste of cassis, that is ferrous sulfate, and the Rasanjana, extract of Indian barberries, means Daru Halad, and the honey. You may apply this in Apakvavastha to the Talu Pradesh. And Kavala, everyone knows of cold decoction of drugs having sweet taste, Vata, Rakta, Pitta, Shamana. The dravya should be like that way. And Vrana Ropana in after treatment. Means Apakvavastha goes, then Vrana Ropana dravya you can use. In Pakvavastha, Ashtapad incision is done that drain all the abscess-like structure. Means what Acharya said, that you should debride this all the palate which is invaded by the mucormycosis. De-roofing of abscess means the invaded mucormycosis with all the tissue, it should be removed in Pakvavastha. But in this mucormycosis, when there is a black patch or the red patch at the Talu Pradesh, when you have the MRI and the CT with you, then you know how to go inside and how much tissue should be taken out. So at the time of when Acharya thinks this Ashtapada incision at the Talu Pradesh, scrubbing with drugs, after debridement, you should have the Tikshna and Ushna Dravyas for the scrubbing and for the Shuddha Vrana after debridement of that tissue. And these Gharshana, scrubbing means Gharshana by these Dravyas, Tikshna Ushna Dravyas, to remaining Dosha Shodhana. Kavala, gargles, with decoction of bitter drugs like Vasa, Nimba, Patola, Jati, Karavira, Guduchi, Kutki, Haridra, Daru Haridra, bamboo shoot, Kantakari, with added honey and sesame oil. First, you should use without honey and sesame oil in Apakvavastha. When it goes Apakvavastha, when these are the Dipan Pachan Dravyas. When the doshas are Apakvavastha goes, then you can use the honey and sesame oil in the Ropan Avastha. So you may have a very good results by these gargles in your OPD. So decoction of the bitter drugs. Vasa, Nimba, Patola, Jati, Karvira, Guduchi, Kutki, Haridra, Daru Haridra, bamboo shoot and Kantakari in Apakvavastha with added honey and sesame oil in Pakvavastha in Vrana Ropana. Because it is in Vrana Ropana you should have the sesame oil or honey. This is the Talugata and going towards the Netra of mucormycosis. In Ayurvedic point of view, it is Akshipakatte or Sashopa Akshipak. You can call it as Sashopa Akshipak. In Akshipakatte or end ophthalmitis. So all the eyeball is inflamed totally, and cornea in advanced stage, it is totally opaque or totally white. It is not like that of normal cornea or black cornea. This is the Akshipakatte, means all the layers of the sclera, cornea, and all the layers are covered by this mucormycosis. Shopa Saramba, Dushta Kledasrava, photophobia, and the pain. These are the when mucormycosis invaded from the maxillary sinus towards the retrobulbar tissue, then these lakshana you may get: Shopa Saramba, Dushta Kledasrava, photophobia, and the pain. There is very severe pain in the eyes. Or when angiovasion is there, you may get the central retinal artery occlusion, CRAO. But this is from the maxillary sinus towards the retrobulbar side. Thinking for the danta area or the dental area, danta vidhradi, it is the initial stage of mucormycosis. It should be drained or it should be debridement by the surgery. It is sadhya. But in later stage, it goes towards the Saushira and Mahasaushira. When all the tissue, bone, upper jaws, all your gums and the teeth are invaded by the mucormycosis, then condition is called the Sushir. It is very kashtasadhya. But with surgery, you can manage the patient. Still, angiovasion is not there. In Mahasaushira, why it is asadhya? Because vessels are also invaded by the mucormycosis. The angiovasion is there. So these are the diagnostic conditions by Ayurveda: Danta Vidhradi, Sushir, and Mahasaushir. So what about the Danta Vidhradi? A swelling inside and outside the gums. I saw the one patient in my OPD. Above the incisors, you get the pockets of that pus pockets or that mucormycosis pockets on the upper part of the incisors, or the below the means there is a due to the invading of the mucormycosis, whole gums may involve, or the one side of the face may involve according to the mucormycosis site. So swelling inside and outside gums due to the vitiated Vata, Pitta, Kapha, and the Ratta, we call as Danta Vidhradi. The symptoms: swelling, pain, burning sensation, and the bursting hemopurulent discharge. When in lateral stage, you get this. In Saushira, vitiated Vata, Pitta, Rakta causes painful swelling at dental roots, in gum area especially, associated with profuse saliva and deterioration of the gums. So when patient comes in our OPD, that there is no dental sensation. When he eats, the patients don't have any sensation of that bite process, or there is no any pain in that area also. This is the invaded the classical signs of mucormycosis. It invades the bone also, and it invades the all nerves area. All nerves are invaded by that. So there is no sensation in later or in advanced stage. So we know the with the symptoms, we know the condition of the mucormycosis, which stage is there. So we can handle by Ayurveda, or we should refer the patients towards the modern science, or give only the Shamana Chikitsa to the patient. These are the diagnostic signs in the patients. So in that lower paragraph, you see the Danta Vidhradi, it is Sadhya, Sushira, Kashta Sadhya, and Mahasaushira. It is a Asadhya. In the treatment part of the Sashop Akshipak or Akshipakatya, you should need the Purana Bhrutapana, Sira Veda, and Rechaka. Because the condition, this is the pure line of treatment in Sashop Akshipak. Sira Veda or Jalauka Charan, you should use this. in early stages of endophthalmitis, you get the very good results by these Purana Ghrutapan, Siraved and the Rechaka. Rechaka with the Manuka and Haritaki Kada and Tirud Ghruta, in that you get the very excellent result. But not only the one drug, but simultaneously Siraved or Jalaukacharan and Purana Ghrutapan. These total line of treatment should be given in endophthalmitis patients, or the treatment in a Sashopakshipaka, or early stage in the mucormycosis. In Akshipaka, in Alpa Shofa, means in mild swelling, in Shofa, moderate to severe swelling. What should be the protocol of the treatment? The protocol should be Snigdha. Purana Ghruta is a Snigdha in nature, Dosha Shamana by this Purana Ghruta. In Siraveda, in all Urdhva Jatrugat Rogas, this is a very good treatment as a Siraveda. You may do the Siramoksha by external jugular vein. Siragata doshas are removed by this Siraveda treatment. Snigdha Rechana should be given in these patients of mucormycosis, because Bala and all these what we called is very less in that. So Draksha Haritaki decoction and the Tirud Ghruta should be given in this further Rechana. Draksha having a Shita property, Sakshusha, Bruhana and Kapha Pitta Anugata. Haritaki Ruksha Ushna Sakshusha, Bruhana Anulomana Tikto Sushna. And Tirutta Ghruta Ushna Snigdha Kapha Pitta Hara Dosha Shodhana without losing the Bala of the Netra and Bala of the patient. Because the Netra Bala in Akshipaka is very, very less as like COVID-19 patients. So you should use this Snigdha Rechana, Draksha and Haritaki decoction plus Tirurughrut in all these COVID-19 and mucormycosis patients. So this is very important treatment, Vyadhi Pratyanik Chikitsa, you may call this. When patient is in front of eye, you see the condition of the patient. So which type of treatment? It should be a Rakta Mokshana, Siraved Jalauka, Virechana, Koshto Shodhana as per Bala, Nasya Kavala Gandusha. So you may, which treatment should be given as per the condition of the patient. And in Shaman Chikitsa, I generally using in day-to-day practice is Manjishtadi Kashayavati. This is Pitta, Rakta, Kapha and Rasayana tendency. So this is the very good drug in mucormycosis. Triphala Gugul as a Lekhana, Pitta, Rakta and Rasayana in Guna and Purana Ghruta. Or you may use the other Ghrutas also, which is Tikta, Shita and Pachaka in Shruti Dravyats. Shroto, Sira, Shodhana, Balya, Oja Ruddhi. So in Shamana Chikitsa, you should keep in mind that what the Bala of the patient, you should give the dose of these dravyas. When Bala is in Uttama condition, then you should use Manjishtadi Kashayavati 1 TDS. Triphala Gugul 2 TDS. If patient is young, you may give the Triphala Gugul in 3 TDS for the 2 to 3 days to reduce the moderate stage of the patient. And Manjishtadi Kashayavati is also 2 TDS. And Purana Ghruta should be given because the age of the patient is very much less. So Purana Ghruta is a property, is a Ushna in nature. So it not needs to digest by the Agni. So it is very, very important. And Oja Ruddhi by the Purana Ghruta is there. So you should frame out this treatment in every COVID patients. Because why I am saying this, Manjishtadi Kashayavati and Triphala Gugul, this is abundantly available in the market, and every Vaidyas is using these drugs. There are many more drugs as your diagnostic conditions you may use in your patients. Is one of the treatment is Nasya. there is may or may not be given in avastha. In apakva avastha, you should not use nasya because it aggravates the doshas. After deepana pachana dravyas, like manjishtadi and trifaladi dravyas, patient feels the less what we call the inflammation, pain, and they reduce all the conditions of the mucormycosis symptoms. The when the come after the treatment, the patient feels very less problems. After that, you can give the Shada Bindu Ghrut. And what is the action of this? The dravyas are the Maka, Lavanga, Yashti, Kushta, Shunthi, and it should be in Gogruta Bhavita. We call this 6 dravyas as a Shidabindu Ghruta. It should be given in Pinas Shirogata Roga Shatam Chanti. So, in Pinas Roga, Shirogata Roga, it is very good, essential in Pakvavastha or after the Amavastha is gone. These are the actions of all these dravyas: Maka, Lavang, Yashti, Kushta, Shunthi, and Indian Kaughi. These are the Balya, Chakshushya, Balakarak, Vranakarak, Pachana, Chakshushya, Agnikara, Balya, and the Rasayana. And Pratisarana and Gandusha, you can use the Lodra, Musta, Rasanjana with honey or Ghurta Manda in Gandusha. For the Pratisarana, use Lodra, Musta, and Rasanjana. When mucormycosis, you can see in the Talu Pradesh, you can see in the gums. This is the kalpa which is very, very beneficial in that condition. In Amavastha, you can use this because it is a Pratisarana. It is not having the property of the Snigdha Dravyas. It is the Rasanjana, Musta, and Lodra. It is Lekhana Dravyas. With Ghrutamanda and Gandusha, in Ropana Avastha, you can give the Gandusha. Now, going towards the patient. So, I directly go towards the 4 patients which I saw in my OPD. This is one patient from Pune. The treatment is started on 23rd of April. The patient having the double vision, the patient having all the movements of the eyeball are the lost, and he is having the 85 to 90 SpO2 conditions. Means I read this 5 एप्रिलला डिस्चार्ज मिळाला, नंतर तोंडात छाले झाले होते. 0 लेवल मीन्स SP2 लेवल्स इज 88, यावर येत नव्हती. नाक खूप चोकअप होत होतं, मीन्स देर इज अ ब्लॉकेज ऑफ द नोज. डोकं खूप जड झालं होतं. देर इज हेवीनेस इन द हेड. नाकाचे आणि गाळाचे बोन पेन करत होते. देर इज व्हेरी सिव्हिअर पेन इन दॅट लॅटरल साइड ऑफ द फेस. लेटर्स 2 दिसत होते. मीन्स देर इज अ डबल विजन आफ्टर रीडिंग. देन द लेटर्स हलत आहेत असं वाटत होतं. द लेटर्स आर मुव्हिंग व्हेन ही सॉ द लेटर्स. वॉशरूमला गेल्यावर धाप लागत होती. देअर इज अ ब्रेथलेसनेस गोइंग फॉर द बाथरूम्स. खूप विकनेस होता. देअर इज व्हेरी ट्रिमेंडस विकनेस इन दॅट. 23rd एप्रिल ही स्टार्टेड द मेडिसिन्स. 4थ्या दिवसापासून सर्व कमी झालं. आता SpO2 लेवल 90-91 इतकी असते. मीन्स ऍट द रेस्ट कंडिशन्स ही हॅज अ गुड O2 आफ्टर 4 days ट्रीटमेंट. पण डोकं थोडं दुखतंय आणि गरगर आहे. मीन्स देअर इज अ सम पेन इन हेड एरिया अँड व्हर्टिगो. बाकी खूप चांगला फरक पडला आहे. दिस इज द व्हॉट्सॲप स्क्रीनशॉट. Because I didn't see the patients, only reports are there. So after having a good video conferencing, then I started the treatment. And after 4 days, see, when any disease having a property, very acute conditions, in acute disease, you may get the results very early. Because in chronic conditions, we know the treatment is long lasting. But in acute conditions, you get the results as per the acuteness of the disease. So, as the results of these patients, I can say that everyone should give the treatment or the dose of the Shamana treatment. That patient should have the results within 4 to 8 days. And like these cases, I have 4 cases today, and every patient having the results within 4 to 8 days to 12 days. This is case number 2. The treatment date is 1st of this June. In the report, you can see opacification of right frontoethmoidal recess. This is MRI report, and in other side, this is the KOH concentration non-septate fungal. Means the non-septate fungal is seen in this KOH titrate. So this is the diagnosed patients, but patient patient didn't undergo the punch biopsy. This is because the after in moderate patient is in mild to severe condition, mild to moderate condition, not in severe condition. Patient is moving and patient having this type of problems. You see the edema of this total eyeball is reduced within 4 to 5 days. Because treatment started, you should read this the 1st of this June, and now the 5th of June today. Within 4 days, the total redness, it is not total redness, but lower side of the eyelid, you see the reduced redness. The eye is not opened properly. It should get opened by the finger. The lag ophthalmos is there, eyeball is totally closed, and edema is, you see the chemosis also, and cornea is embedded in that chemosis. This is the classical sign of the mucormycosis. And you see on the right side, the eyeball means eyelid is open within 4 days of the treatment. Bidalak is also given for this patient. You may use the Jivantyadivruth by externally. Any treatment or Anjana or Ashodhana should not use. This is the Amavastha. You should treat the patient by Shamana Chikitsa only first. When Amavastha goes, then you can treat the patients by Anulomana, Virechana or other Panchakarma therapies. This is case number 3. I saw this patient on 26th of May. On the left side, you see soft tissue left maxillary sinus. In MRI, the CT PNS without contrast, the finding is soft tissue left in left maxillary sinus and broad branching hypocele in KOH titration. These 2 reports of these patients. You see the date also in that both reports. I seen these patients in the 26th of the April by video conferencing only. That there is only pain at the site of the maxillary sinus. There is only one sign, and other is pain in the teeth area, and thus some sensation is lost in some areas of that teeth. These are the symptoms by this patient. So I see the patient by only video conferencing, and I told patient to go towards the referred patient toward the modern surgeon. The ENT surgeon saw the patient and done these reports, and when he saw the MRI and CT reports that in left maxillary sinus there is a soft tissue in that. So and he done the endoscopy also. and see the and saw the conditions where the mucormycosis is present, but there is no any eye problem. So this mucormycosis is only in left maxillary sinus. This is the picture of post-op maxillary debridement. All the debridement is totally removed by that surgeon, but this surgery is was done around 4 days before. This is the recent photograph of the patient. My treatment is started on 24th. See, these are the reports. Reports is 26, but treatment is started at 24. After 8 days treatment, patient having a very good result for the pain and the loss of sensation at the site of teeth. So after the treatment, the pain is gone and the patient is able to chew or able to take his dinner and lunch also. Because before that, the patient having there is no sensation when she eats. So I referred the patient towards a modern ENT surgeon. What the avastha of the patient is, which it is a moderate stage, it is a mild stage, or it is the advanced stage, or other problems also. So there is no any systemic sign. There is only a localized sign and the symptoms of the patient. So after the 8 days of treatment, patient have the 80% relief. This is the 4th case. This is a very good case because I have the all evidence of this case before and after treatment. This is patient came in my OPD 27th of May. This in right photograph, you can see there is a lack of ophthalmos, there is edema. Patient can't open his eyes. There is no double vision because the lack of ophthalmos due to the close of the eye. He saw only with one eye. So now, after presenting him to in our Netrayo hospital, he has a very severe pain at the site. And you see the before and after, the edema is totally gone. Treatment is started on the 27th. So within 10 days, patient having this much relief before and after. And there is a muscle paralysis, means ophthalmoplegia. You see in the right photograph, when we see, ask the patient to see towards the left side, the right eye is moved, but left eye can't move. So it is a ophthalmoplegia. We called as a condition as a ophthalmoplegia. After 8 days of treatment or 10 days of treatment, Shaman treatment only. I will present this case after seeing this photograph that he is a COVID positive. It's a history of COVID positive and having a homeopathic treatment. I told earlier when our presentations when started before. So this is a left lateral movement before and after. You see the totally lid edema on the right side. You see the lid edema is totally gone. Is somewhat remain on the lateral side. The eye movement is complete. You see both eyes are towards the lateral side. Is very easily. On the right lateral movement, you see in the first photograph, left eye is not able to move on the right side. But in the second photograph, you see the reduced lid edema and both eyes are in synchronized conditions. In upper gaze movement, you see the right eye is moved towards the upper gaze, in the but left eye can't move. Somewhat movement is there. So this is the sign, thus mucormycosis, how much invaded the eyeball. When there is a complete absence of the movement of the eyeball, the condition is called as a complete ophthalmoplegia. The both eyes means the hampered eye is totally paralyzed. So in here we diagnose the condition clinically that the patient having mild to moderate condition of the mucormycosis. So you see the left eye, you see the total both eyes synchronized movement on the upper gaze. And in lower gaze, you can see the left eye in the first photograph is not moving, or in the lower gaze. In the right side photograph, you see the patient is totally free. So what is the take home message after presenting this? The take home message is that Ayurveda treatment is most important in this mucormycosis, we called as a mucormycosis pandemic, because every state is means declared that these mucormycosis cases should be treated under the totally in government hospitals, because there is a lack of amphotericin B. So the whole management should be done at civil hospital area. So for the take home message, the prevention is the main key for the Ayurveda. Only by Ayurveda treatment. COVID-19 complications, the prevention of the COVID-19 complications or mucormycosis should not be have the by to the patient. So only by Ayurveda treatment it should be done. Early and mild stages only by Ayurveda or Ayurveda plus modern or SOS surgery. Because in mild stages it should not be invaded further at the or the advances towards the bone invasion or in the advanced stages. So keep in mind that how much the treatment area should we decide. It is by only Ayurveda or Ayurveda plus modern or Ayurveda modern plus surgery. So our role in early and mild stages is very big. In prevention also, in early stages also. In moderate to severe cases, you should have the Ayurveda modern plus surgery. These all combinations should be used. But these 4 cases I presented here, they all, except the first case, which have the left maxillary debridement plus amphotericin B plus Ayurveda. But it is moderate to severe. It is written only maxilla. But other cases are the Akshipakatya cases or the mucormycosis ophthalmia. Moderate to severe, Ayurveda modern plus surgery. These all the remaining 3 cases have only Ayurveda treatment. After diagnosis of mucormycosis by biopsy, punch biopsy, patient consent must be. Why? To treat by Ayurveda. You should take the patient consent. Why? Because it is a life-threatening. If you suggest the patient to take only Ayurveda treatment and within 3 to 4 days, or you did not get the proper diagnosis, or don't know the avastha, or your diagnosis may go wrong, so patient may have the angiovessel. Means vessels may invade in that condition, and patient land into the other matter also. So it otherwise legal matter will harass you. So patient consent should you take. Mortality is too high, so do not give full assurance to near one also, despite of you have the confidence. So this is the main take home message, that when you know the condition of the patient, so you should go for that avastha and the treatment, and you should observe the patient every day, every 2 days, because it is a 2020 match. If Ayurveda treatment of mucormycosis allowed by the government, the scenario will definitely change. Why? I already explained the point, because Ayurveda have a very great role as a bala of the patient, as oja, to increase the oja of the patient, and having a good property of Ayurvedic panchakarma for the patients. Kavala Gandush Nasya Netradhara Bidalaka, by all localized treatment, can have early arrest to the disease. This localized treatment is found in Ayurveda only. So, you should diagnose the conditions in Pakvavastha and Apakvavastha, then use these conditions as in your OPD as the avastha of the patients. After confirmation of mucormycosis, medicine plus surgical managements. Hence, do not force patient for Ayurveda treatment only, because when we get invaded into the bones and the disease spread is more towards the upper part of the face and total lower part of the face and lower upper jaw, it requires the surgery. It required the emergency treatment. So, but it's your patient, is day-to-day patient or your relatives. You should not waste the time for the Ayurveda treatment, because Ayurveda treatment has a very great role to reduce the mortality of the patient. This is the take-home message today. So this is all about the mucormycosis. So what the message at the last? You should always handle these cases in your OPD at the mild, moderate and the severe conditions, and by Ayurveda, Apakvavastha and Pakvavastha. Apakvavastha, you give the Shamana Chikitsa, and in after Apakvavastha, Pachana Dipana, then you go for the Anulomana and the Virechana. Nasya, Kavala, Gandusha, Netradhara or Bidalaka. So I have the one video also of that patient, how the movements of that patient eyeball is started within 8 days. At the last, I should talk for that this case. This patient I referred to the civil hospital nearby to see, because it is condition is mild to moderate. I don't know how much the bone level it is invaded. So there is no any MRI, no any CT scan. Patient directly comes to me. There no any report of this patient. So I referred patient to the civil hospital. But this is a COVID-19 positive diabetic patient. 1 month before he had the COVID-19. At the home, he taken the homeopathic medicines and cure his COVID-19. He has no any history of admission, no any history of any allopathic Fabiflu and steroids. He has given by the doctors. He is cured by only the homeopathic medicine. Still, he got the mucormycosis. So you should use your face mask very clean or disposable mask, 3-layered mask. You should ask your patients, relatives, and your all nearby peoples that face mask also the problem of this mucormycosis. When I saw this patient, there is no any history I got for the mucormycosis. Still mucormycosis is there. So this patient is very much faith on me, on the Netra Hospital, because he is having a diabetic retinopathy before this. He is having a multiple injections in the vitreous, for the retina, for the diabetic retinopathy. He got the 1 year before, he got very much good results by diabetic retinopathy treatment in our hospital. So having a very good faith on us, he directly came to us. And when he goes home, yesterday I called him that you saw nearby your doctor or not. Patient, give me the answers. I am at home only and taking your treatment only. I didn't see any surgeon. I didn't go any hospital, or only by your treatment I got a good result. When I called him by video call, he told me to make a video call that see the condition of the eye. So I surprised that all movements get started and lid edema is totally gone. You see on the right side photograph the patient. This is very surprising me also, not for the Ayurvedic people, but also surprising me. But he having a faith and taking only Ayurveda treatment, Shamana Chikitsa, there is no any Panchakarma Chikitsa. Only 8 days, means today is having 7th day of his treatment. So I want to show you the video of this patient. Can I, madam, can I show the video?
Yes, sir. ये कीजिए, ये stop कीजिए, PPT stop कीजिए, then you share your video also. You can share. Yes.
Okay, okay.
Really amazing, sir. Very nice, very great. इतना डिटेल में हमने पहली बार ही सुना है, और इतने मतलब सभी आपने सभी पर्सपेक्टिव, आयुर्वेदा, मॉडर्न, लिमिटेशन, सभी बहुत ही विस्तारित रूप से आपने पढ़ाई भी की है, और बहुत ही अच्छा प्रेजेंटेशन था. वेरी नाइस एंड वेरी यूजफुल.
How the file we will choose?
सेम सर, सेम प्रोसीजर. शेयर स्क्रीन कीजिए, वीडियो डेस्कटॉप पर है ना, तो बस उसको,
हाँ डेस्कटॉप पे है.
फिर शेयर स्क्रीन कीजिए, आपको दिखेगा. किसी को कुछ क्वेश्चंस है तो प्लीज यू कैन अनम्यूट योरसेल्फ. आशा जी, वंदना मैम.
मैम किसी ने पूछा है, सर ने मुझे पता नहीं यूज किया कि नहीं, रोल ऑफ मिथिलीन ब्लू. कोई संगीता तिवारी मैडम है, अगर वो जूम पर जुड़ी हैं तो वो खुद पूछ सकती हैं अपने क्वेश्चंस. उनके 2-3 सवाल हैं, और एक उनका सवाल है इसके बाद कि इज कोविड इन इटसेल्फ indirectly responsible for mucor infection apart from steroid, DM और other factors. इसका मतलब समझ में नहीं आ रहा. मुझे लग रहा है कि क्या म्यूकर माइकोसिस ऐसे भी हो जाता है, या
हाँ, मैं भी पूछने वाली हूँ यही सवाल. I have same question कि म्यूकर माइकोसिस is always related with eye problem, or it can be separated with this from this COVID.
ये अपने आप भी हो जाता है मतलब ऐसे.
Madam, how to share this? I didn't see the path.
शेअर ऑप्शन करा आणि त्याच्यानंतर तुमच्या डेस्कटॉपला, हा डेस्कटॉप दिसेल तुम्हाला, त्याच्यावरती क्लिक करा परत एकदा.
शेअर स्क्रीन मला डेस्कटॉप नाही दिसत आहे.
शेअर स्क्रीन केल्यावर डेस्कटॉप दिसतो. हा, आता तुम्ही व्हिडिओला क्लिक करा.
ओके 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 ओके.
यू गॉट. हा,
You are able to see?
Yes. Very nice.
There is ophthalmoplegia in all quadrants. In right side there is some movement. So there is no any left lateral movement. Okay. Once again, I am able to play this or not?
Click करा एकदा परत.
Because it is very short video. No, it is not working.
Same procedure again. हाँ.
Yes. I will comment. I am asking the patient to see on the left side there is no any movement. I am asking to see in the upper side there is no any movement. There is some movement on the right side, but at lower side there is no any movement. Okay, and you can see yesterday on video call I taken this video. You see the patient at home. Varti baga. You see the patient, the movements on the upper side. You can see on the right side. मान सरळ ठेवा. हो, डाव्या बाजूला बघा. You can see the total movements on the left side. वर बघा, वरच्या बाजूला. On the upper gaze, there is a lag ophthalmos. So, वरच्या बाजूला, डाव्या बाजूला आणि उजव्या बाजूला. सो
वेरी नाइस सर.
स्टॉप शेयर करा बस.
यस 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 यस.
इसका सर आपने सर पंच करके इसको कंफर्म किया हुआ था कि ये म्यूकरमाइकोसिस का ही केस है?
No, because he is having a diabetic retinopathy. एक बरस पहले वो मेरे पास आया था. He is having a diabetic retinopathy. तो इंट्राविट्रियल इंजेक्शंस उसने लिए थे, उससे उसको कोई आराम नहीं था, मैकुलर एडिमा था उसको. आफ्टर आयुर्वेदिक ट्रीटमेंट he got a very good results. On the 27th of May, he came to our hospital and I saw the case. And this is a typical means there is a chemosis, there is ophthalmoplegia, and there is a lag ophthalmos and lid edema. And how much the history is within a 2 to 4 days, only 4 days history he is having these symptoms arise. So हम अक्षिपाकात्य बोलते हैं, एंड ऑप्थेल्माइटिस. सो इट इज अ कंडीशन ऑफ माइल्ड टू मॉडरेट कंडीशन, इट इज नॉट अ सीवियर कंडीशन. सीवियर हो जाती है तो उसको इनिक्लेशन ही करना पड़ता था, बिकॉज देयर इज अ वेरी थ्रॉम्बिंग पेन, बिकॉज बोन इन्वेड होने के बाद में देयर इज नो एनी चांस, बिकॉज मसल्स भी उसके पूरे म्यूकरमाइकोसिस से पूरे खत्म हो जाते हैं, बोन खत्म हो जाता है और आईबॉल के लेयर्स भी खत्म हो जाते हैं. So only in that moderate and to severe condition, you should have the only one, it is enucleation, means total removal of the eyeball. So it's only having a Ayurvedic treatment, I got this surprise result. I am also surprised within 10 days how the result is there. But I given him only Manjish Thadi Kashayavati, Triphala Gugula, for the Bidalaka, this Shatavariyadi Ghruta, which we prepared in our pharmacy, and the Koshta Shodhana, because the patient having a good Bala is in uttam condition and is having a good Oj, no any problem. His overall condition is good.
Yes sir.
सर ये
मिथिलेन बताइए. मिथिलेन, हाँ
मैम आप पूछिए प्लीज.
नहीं, मिथिलेन ब्लू के बारे में कुछ मैडम ने पूछा है, डॉक्टर संगीता मैडम ने, कि क्या है ये, इसका रोल क्या है म्यूकरमाइकोसिस में?
हाँ, मिथिलिन ब्लू अभी मैंने भी कैसे है, सी दिस म्यूकरमाइकोसिस वर्ल्ड is new for everyone, is new for modern peoples also, is new for us, is new for everyone. So मैंने जो सुना था कि मिथिलिन ब्लू से आजू बाजू के जो मीन्स इट इज यूज्ड इन COVID-19 पेशेंट टू प्रिवेंट the infection. It is not used in the mucormycosis. See, this is the main condition. To prevent the COVID-19 virus, it should be used. Because like Nasya and the gargles, with Ruksha, Tikshna Dravyas, the same properties of methylene blue. It is a Ruksha. Methylene blue is a Ruksha. When that area cough, means nasal cough and the oral cough, it is removed by that gargles. और कोई तो पीने के लिए भी यूज कर रहे हैं मिथिलिन ब्लू, कोई काफी डॉक्टर्स ऐसे भी मैंने सुना था. लेकिन it is only for the virus. It is not used for the mucormycosis. Keep in mind.
सर एक उन्होंने घृत के लिए भी पूछा है कि आपने पुराण घृत कहीं बताया है, तो क्या पंचतिक्त घृत या महातिक्त घृत यूज करना है या पुराण घृत प्लेन
ओके
रखा हुआ यूज करना है?
तिक्त शीत और उष्ण द्रव्य यू कैन यूज. ओके, पुराण जो तिक्त घृत या महातिक्त घृत है वो भी आप यूज कर सकते हैं, लेकिन तुरंत बनाया हुआ जो है, क्योंकि बहुत सारे वैद्य घृत मूर्छित करके नहीं घृत बनाते. घृत मूर्छित करके आप बनाते हैं तो उसमें का स्निग्ध जो ये प्रॉपर्टीज है उसकी गड़बड़, मीन्स क्लेद निर्माण करने की वो कम हो जाती है, बहुत सारी कम हो जाती है. दैट सपोर्ट्स द म्यूकरमाइकोसिस टू ग्रो. बिकॉज म्यूकोरमाइकोसिस को आपको सबसे पहले मीडिया चाहिए टू ग्रो. सो वो घुटनों से आप मीडिया बढ़ाने वाले नहीं हो, ये पूरा ध्यान में होना चाहिए आपके। ओके, दैट्स व्हाई पुराण घृत इज यूज्ड, बट इन अपक्वावस्था यू शुड यूज द रोक्षण दीपन पाचन द्रव्य फर्स्ट। सब सिम्टम्स कम होने के बाद में आपका जो पुराना घृत नहीं है तो बाकी घृत आप आफ्टर 4 days और 6 days यू कैन यूज, बिकॉज वी हैव अ टाइम लिमिट फॉर द 15 days, 20 days और 25 days फॉर दिस म्यूकरमाइकोसिस।
ओके सर, आपने बताया था कि आप आयुर्वेदा से डिब्राइड करते हैं उसको उष्ण तीक्ष्ण द्रव्यों से, तो आपने कितने ऐसे पेशेंट्स में डिब्राइड किया म्यूकरमाइकोसिस को आयुर्वेदा?
I am only ophthalmologist, so I not means दंत या कवल या ये जो पेशेंट है सुशिरमा, सुशिर तालुपाक या गम्स के, मैं ज्यादा यूज नहीं किया हूँ तो मुझे उनका अनुभव नहीं है। लेकिन आंखों के बारे में जरूर मैं कहना चाहता हूँ कि अंजन आश्चोतन वो कभी भी यूज नहीं करना है। आप मैं एक्सटर्नली यू कैन यूज, पर जो द्रव्य जो है वो वृक्ष और लेखन होने चाहिए, यानी कि दीपन पाचन गण के होने चाहिए। मीन्स लोकल नेत्रधारा एंड बिडालका यू कैन यूज इन दिस कंडीशन, एंड नस्य आल्सो यू कैन थिंक फॉर दैट आफ्टर द पक्वावस्था। ओके, और अपक्वावस्था के जो लक्षण है, आमावस्था के जो लक्षण है, वो सब खत्म होने के बाद में आप षडबिंदु घृत यूज कर सकते हो। उसका काफी परिणाम है, अच्छा है, और इट इज गिवन एज अ व्रण रोपण। ओके, मीन्स म्यूकरमाइकोसिस ने जो कुछ वहां पे इनर लाइनिंग को सबको डैमेज करके रखा है, तो रोपण के लिए आप षडबिंदु घृत इज वेरी गुड इन दिस कंडीशंस।
जी सर, ये तो वैद्य जो है हम सब जानते हैं कि नॉर्मल बीएमएस तक सब लोग अक्षी तर्पण, विडालक इसको सब जानते हैं। रक्त मोक्षण भी बहुत से लोग प्रैक्टिस करते हैं, बट जो जनरल पब्लिक हमारे आयुष दर्पण से केवल वैद्य ही नहीं जुड़े हुए हैं, नॉर्मल पब्लिक भी जुड़ी हुई है, तो म्यूकरमाइकोसिस से वो सब बचे रहें, उसके लिए एज एन ऑप्थेल्मोलॉजिस्ट आप क्या बताएंगे करने के लिए?
देखो, उनको सबको सबसे पहले नियर बाय वैद्य के पास जाना ही है, बिकॉज सी कोई पेशेंट ऐसे भी रहेंगे शायद कि उसको कोविड-19 नहीं है। ओके, ये जो पेशेंट मैंने अभी जो बताया उसको कोविड-19 1 महीने पहले हुआ था, सिर्फ होम्योपैथी लिया था। देयर इज नो एक्सपोजर ऑफ फेविफ्लू एंड अदर रेमडेसिविर एंड अदर स्टेरॉइड्स एंड अदर टोसी आल्सो। There is no any exposure of this treatment.
सर का इंटरनेट कुछ प्रॉब्लम दे रहा है।
हाँ, yes.
Wait, I have a call.
It's okay.
It's okay now? Okay.
हाँ, yes sir. Continue.
उसको सिर्फ एक ही प्रॉब्लम मुझे मिला था, वो हैविंग अ हिस्ट्री ऑफ डायबिटीज। वो भी डायबिटीज इतना था कि उसने रेटिनोपैथी तक अपने पैर जमा लिए थे। मीन्स देयर इज अ कॉम्प्लिकेशंस ऑफ डायबिटिक लाइक अ डायबिटिक रेटिनोपैथी, नेफ्रोपैथी एंड अदर प्रॉब्लम्स आल्सो। लेकिन बल उसका अच्छा था। सो यही पेशेंट में आप नस्य यूज कर सकते हो, कवल गंडूश यूज कर सकते हो, बिडालक यूज कर सकते हो। कवल गंडूश why? Because it is in only it is hampered by only अक्षिपाक। मीन्स अक्षिपाक के लक्षण वो लेके आया था सिर्फ। देयर इज नो एनी प्रॉब्लम इन मैक्सिलरी एरिया, नेजल एरिया एंड ओरल एरिया। और जो नॉर्मल पब्लिक है उन्होंने नजदीक वैद्य के पास जाने के बाद उनको कोविड-19 के है तो एज अ प्रिवेंशन गार्गल्स, आप गंडूश और नस्य वो उन्होंने करना ही चाहिए, बिकॉज म्यूकरमाइकोसिस यही एरिया में होता है स्पेशली आफ्टर कोविड-19। लेकिन पहले जो 25 इयर्स या 30 इयर्स का जो एरिया है, तब ये पेशेंट्स ऐसे नहीं थे पहले। म्यूकरमाइकोसिस आपको स्किन पे भी मिलता था या ब्रेन में भी, या अदरवाइज एनीवेयर, हार्ट में, किडनी में, या एनीवेयर यू कैन सी। नेजल एरिया में भी था तब, क्योंकि हेलो, हाँ, स्पोर्स करेंगे द साइट ऑफ इन्फेक्शन वहां से आपको वो इन्फेक्शन होगा। सी लेकिन द रूट जो है अभी जो मिल रहा है हमको, जो रूट मिल रहा है वो नेजल एरिया से ही मिल रहा है, क्योंकि मैक्सिलरी एरिया में जब ये म्यूकस माइकोसिस फैलता है तो अपर साइड में है तो इट इन्वेड्स द आईबॉल, लोअर साइड में है तो इट इन्वेड्स द पैलेट एंड द डेंटल एरिया, और अदरवाइज पोस्टीरियर साइड में है तो इट मे हैव द इंजियोवेजन टुवर्ड्स द बेस ऑफ द स्कल, मींस डायरेक्टली कैवर्नस साइनस में ओपन होता है, और दैट इज वेरी डेंजरस साइन। सो पेशेंट को आप ओपीडी में देखना है कि वो उसके क्या क्या साइंस है। यू शुड थरली ऑब्जर्व द म्यूकरमाइकोसिस पेशेंट थरली, सो द पेशेंट वेयर द साइट इज। और ऐसे पेशेंट कभी कभी आते हैं कि आपके पास एमआरआई सीटी कुछ भी नहीं है, उसको सिर्फ वर्टिगो है, तो बेस ऑफ द स्कल से उसने डायरेक्ट कैवर्नस साइनस को इन्वॉल्व कर दिया और आपको पैरालिसिस लेके पेशेंट आया है। लेकिन आपको उसको देखना है कि ये कोविड-19 की हिस्ट्री है क्या, इसको डायबिटिक की हिस्ट्री है क्या, इन्होंने फेविपिल लिया है क्या, रेमडेसिविर टोसिल लिया है क्या। यू शुड गो थरली फॉर हिस्ट्री ऑल्सो, so then you have the proper diagnosis, clinical diagnosis.
नहीं सर, मेरा मतलब ये था कि एक जनरल पब्लिक को सभी प्रकृति के लिए उपयोगी नस्य कवल गंडूश या अक्षी तर्पण प्रक्षालन के कुछ द्रव आप छोटा सा एक बता दें तो जो नॉर्मल हमारे साथ ऑडियंस जुड़ी है उनको प्रिवेंशन के लिए।
मैडम देखो, पब्लिक के लिए बताना है तो त्रिफला सब तरफ मिलता है
जी।
तो त्रिफला का डिकॉक्शन आप रुक्षण के लिए, जिसमें अमावस्था हो थोड़ी सी बॉडी की, तो पहले त्रिफला का सिर्फ क्वाथ से आप कवल कर सकते हो, और व्हेन यू गेट द लाइटनेस फीलिंग इन द माउथ देन यू कैन ऐड, मींस आप उसमें तेल डाल के कवल कर सकते हो, क्योंकि वहां पे रोपण भी होना है आपको। पहले दोष शोधन होना है, दोष शोधन होने के बाद रोपण चिकित्सा है। तो जब तक आपको मुंह में दांतों को, आपके मसूड़ों को हेल्दीनेस नहीं लगता है और देयर इज अ पेन एट द टाइम ऑफ च्यूइंग, सो तब आप सिर्फ त्रिफला से रुक्षण से कवल कीजिए। उसके बाद में आप तेल डाल सकते हो, आप तिल का तेल यूज कर सकते हो फॉर दैट, और यू कैन यूज कोकोनट ऑयल ऑल्सो। उससे गार्गल करना जरूरी है विथ उष्ण वार्म वाटर, मीन्स गुनगुना पानी से आप कर सकते हो। और जो कोकोनट ऑयल और तिल का तेल आप नस्य बोल के भी यूज कर सकते हो फॉर पोस्ट कोविड पेशेंट। आप दो तुम प्रतिमर्श नस्य जैसे हम डाल सकते हैं, तो वहां पे वो एरिया में रोपण होना चाहिए, क्योंकि कोविड-19 के बाद क्या होता है या अदर इम्यूनो कॉम्प्रोमाइज पेशेंट को क्या होता है, उनकी जनरलाइज कंडीशन या जो कोमॉर्बिड पेशेंट होते हैं उनको बल चाहिए, मींस शारीरिक बल प्लस एरिया ऑफ दिस बल वेयर म्यूकरमाइकोसिस इज सीन। सो आप सबने नस्य और कवल गंडूश, इट इज वेरी मस्ट इम्पोर्टेंट
जी। अक्षी प्रक्षालन क्या कर सकते हैं त्रिफला का काढ़े से?
त्रिफला से भी आप अक्षी प्रक्षालन कर सकते हैं
सभी प्रकृति,
और अदरवाइज यू कैन पुट हनी इन आईज आल्सो। प्योर हनी है तो यू कैन हैव अंजन लाइक इफेक्ट हनी से।
और क्या अंजन जो सुरमा लगाते हैं और काजल लगाते हैं, क्या इस दौरान कोविड में यूज करना चाहिए कि नहीं? अगर करना चाहिए तो किस समय सुरमा लगाना चाहिए, किस समय अंजन, और क्या नहीं लगाना चाहिए?
नहीं, नॉर्मल जो पेशेंट है जिसको कोई प्रॉब्लम नहीं है वो सब आपका रूटीन प्रोसेस कर सकता है, लेकिन जो इम्यूनो कॉम्प्रोमाइज है, जो डायबिटिक है, जिसको कोविड की हिस्ट्री है और अदर कोमॉर्बिडिटीज कंडीशंस है, तो उसको ये सब करने से पहले, मींस अंजन से पहले, नस्य से पहले अपने डॉक्टर को दिखा दे कि कहाँ आमावस्था नहीं है ना। तो आमावस्था, पक्वावस्था मींस उसका पाचन होने के बाद में आप देखो सब तरफ ऐसे ही बताया गया है कि आपको स्नेह यूज करना है तो आपको सबसे पहले आमावस्था को निकालना होगा। मींस आमावस्था, हाँ मींस प्रतिशय है, आमज प्रतिशय है, मींस कफ दोष का प्रतिशय है, तो आपने नस्य नहीं करना है। ओके, दीपन पाचन करने के बाद शिरो विरेचन के लिए आप शिगुरु या वेखंड या आप ये द्रव्य यूज कर सकते हो शोधन के लिए। लेकिन दोष पाचन, दोष वहां से छूट जाने के बाद में आप उसको पाचन कर सकते हैं। तो आमावस्था में ना यूज करें। आपको समझ में नहीं आता है तो नियर बाय वैद्य के पास आप सलाह ले सकते हो।
एक और सवाल है डॉक्टर दीप्ति मैम का कि शतावरी वृत्त के साथ आपने बिडालखी क्यों मतलब सेलेक्ट किया है?
नहीं, मैंने पहले बताया था कि यू कैन यूज द त्रिफला वृत्त आल्सो, यू कैन यूज द जीवंत्यादि वृत्त आल्सो।
और जैसे मैडम ने बताया अभी पूछा
ओपीडी में अवेलेबल है तो वी कैन यूज इट इज फ्रीक्वेंटली।
सर और एक बात मैं पूछना चाहती हूँ कि एज रिलेटेड कुछ इसमें आप एक्सपीरियंस है या कुछ केसेस है कि बच्चों में या कुछ एज रिलेटेड कुछ आप बता सकते हैं? कुछ फैक्टर ऐसा है कि इस एज में ये ज्यादा हो रहा है कॉम्प्लिकेशन एज अ कॉम्प्लिकेशन?
मेनली अबव 45 इयर्स मीन्स जो मैंने केस बताया था व्हाट्सएप का, सबसे पहले केस नंबर 1 वो 42 इयर्स का था। ओके, कोविड-19 के काफी कॉम्प्लिकेशंस थे उसको, और ये जो कॉम्प्लिकेशन था ऑप्थेल्मोप्लेजिया और डबल विजन और पेन इन ऑल द फेस एंड वेरी हेवीनेस इन द टोटल एरिया ऑफ द हेड, ये सब कोविड-19 पश्चात की म्यूकरमाइकोसिस के सब थे। व्हाई म्यूकरमाइकोसिस? मैंने भी उसको बोला था कि आप उसको ईएनटी को बताना है क्योंकि ऑप्थेल्मोप्लेजिया हो गया था और बहुत आइस था उसको। सो देयर इज अ टोटल मूवमेंट, आई बॉल की सब रुक गई थी, लेकिन आमावस्था था उसको, आम पाचन के बाद उसको तुरंत रिलीफ मिल गया क्योंकि एज इज 42 ओनली। सो उसका बल लेकिन काफी क्षीण था क्योंकि उसका SpO2 लेवल भी आफ्टर बाथरूम को जाने के बाद वो 85 के नीचे 81 तक आ जाता था। सो ऐसे कंडीशन में आप देखो पहले से ही बल कम है और आप आमावस्था भी है, तो आप कैसे यूज करेंगे? तो आपको दीपन पाचन रसायन द्रव्य यूज करना है आमावस्था जाने के लिए। त्रिफला और महामंजिष्ठादि, व्हाई आई एम यूजिंग दिस बिकॉज इट इज हैज बीन अ प्रॉपर्टी ऑफ दीपन पाचन रक्त कफ एंड पित्तघ्न एंड रसायन आल्सो। सो पेशेंट का बल देखने के बाद एवरी 2 days you should see the patient or phone the patient how is your condition. सो उसके बाद में उसका जो डोज है, देखो अपने को रिजल्ट देना है विद इन 5 days, विद इन 10 days, विद इन 15 days, क्योंकि ये म्यूकरमाइकोसिस है, एक ध्यान में रखना है, दिस इज मोस्ट इंपॉर्टेंट। तो ये कंडीशन पेशेंट से आपको नजदीक से देखना है। तो ये जो डोज है यू कैन रिड्यूस द दोष, उसका बल कम होता है काफी, तो यू शुड रिड्यूस द दोष और यू टोल्ड देम टू सी द ENT सर्जन और नियर बाय लाइक दैट।
सर और एक सवाल है कि पल्मोनरी इसमें आपको क्या ये करना है? प्लीज टेल अबाउट द पल्मोनरी MM विथ
म्यूकरमाइकोसिस। सो इसमें तो हॉस्पिटलाइजेशन नीडेड फर्स्ट बिकॉज पल्मोनरी म्यूकरमाइकोसिस हैविंग COVID-19 हिस्ट्री, you should admit the patient because anytime he may land in a sepsis, क्योंकि टोटली ब्लड वेसल्स एक्सपोज होने के बाद वो कभी भी सेप्सिस में, बिकॉज देयर इज वेरी मच अबंडेंट ब्लड सप्लाई टुवर्ड्स द लंग्स, तो इट इज वेरी फास्टली ग्रो in all the vessels in the body, or it may invade in the kidney, it may invade in the brain, paralysis or death. The prognosis is very bad in this lung condition. But in lung condition, when the condition is in early stage, you should use the Ayurvedic drugs, क्योंकि म्यूकरमाइकोसिस ये जो ड्रग मैंने बताया है इससे काफी फास्टली रिड्यूस होते हैं, ये भी ध्यान में रखना है। हमको पेशेंट को काफी क्लोज ध्यान भी रखना है, और दूसरी बात उसको ये ड्रग्स देने के बाद में क्योंकि दूसरा एम्पोटेरिसिन भी यू सी द वेरी मच हाफ एंड हजार्ड कॉम्प्लिकेशंस आर देयर, means there is a renal problem is very much that because it is a renal toxic drug. So एम्पोटेरिसिन भी यूज करने के लिए भी जो फिजिशियन है वो डरते हैं, So which is safe? The Ayurvedic medicine is safe in this condition.
सर धूपन और धूमपान के विषय में पूछा है किसी ने कि क्या ये हेल्पफुल है, उसका कोई रोल है क्या? डॉक्टर शेट्टी ने पूछा है।
प्रिवेंशन के लिए जो पोस्ट कोविड-19 पेशेंट है तो उनके लिए आप ये धूम्रपान चिकित्सा बहुत जरूरी है, बहुत जरूरी है, क्योंकि मैंने जो बताया कि स्टेरॉइड से और कोविड-19 के अपने इंफ्लेमेटरी कंडीशंस के बाद जो ऑस्टियम बंद हो जाते हैं उसको आप धूपन दे सकते हैं। धूपन वो रुक्षण और स्निग्ध भी रहा तो भी चलेगा, लेकिन वो धूपन है तो उसकी वजह से लोकल इन्फ्लेमेशन कम हो जाता है, ऑस्टियम ओपन हो जाता है, और जो फेवरेबल कंडीशन है एनारोबिक रेस्पिरेशन फॉर द फंगस, इट इज टोटली ओपन। सो ऑस्टियम ओपन होने के बाद जब धुआं अंदर जाएगा तो इट इज टोटली एक्सपोज फॉर द O2, और O2 म्यूकस मेम्ब्रेन को जो लाइनिंग है नेजल की और मैक्सिलरी बोन की जो म्यूकस है, तो वो O2 मिलने के बाद उसमें देयर इज मींस लेस कंडीशन टू हैव द म्यूकरमाइकोसिस। धूम्रपान इज यूज्ड इन एवरी कोविड-19 पोस्ट कोविड-19 पेशेंट्स। इट इज वेरी मच बेनिफिशियल।
सर और एक सवाल आया है एफबी पर कि प्रेगनेंसी में किस प्रकार से हम लोग ट्रीटमेंट करें। आपके पास टाइम है ना सर? आपका बहुत शेड्यूल बिजी रहता है, तो जस्ट फ्यू मिनट्स 5 मिनट्स में खत्म कर देंगे।
हाँ जी बताइए।
प्रेगनेंसी में 7th मंथ प्रेगनेंसी में अगर ये इन्फेक्शन होता है तो क्या करेंगे म्यूकरमाइकोसिस के बाद?
See, if pregnancy is there and you should diagnose the अवस्था। मैंने अवस्था पे क्यों इतना बोला है? सो अवस्था के बाद ही आप ट्रीटमेंट कर सकते हो, ये पहले ध्यान में रखना जरूरी है। और देखो, इज द प्रेगनेंसी इन अर्ली स्टेज you should go for Ayurveda only under observation. उसके symptoms कम होना चाहिए. This is first. Second, if it is moderate to severe or mild to moderate, you should go only for Ayurveda treatment only. लेकिन उसका CT MRI करना जरूरी है, क्योंकि उसको बोन इन्वेजन है क्या नहीं, एंजियो इन्वेजन है क्या नहीं, वो आपको ध्यान में आ जाएगा। If there is no bone invasion or angio invasion, you should go for Ayurveda only. और आफ्टर दैट इन मॉडरेट टू एडवांस स्टेज आपको आयुर्वेदा देना ही है, क्योंकि वो एम्फोटेरिसिन नहीं देने वाले। एक बात ध्यान रखना है, इन प्रेगनेंसी ओरल ड्रग अपने सबके अमावस्था के इट इज वेरी मच मीन्स अराउंड 80 to 100% इम्पोर्टेंस। दिस इज अ वेरी ग्रेट रोल इन अमावस्था इन इनिशियल स्टेजेस ऑफ द म्यूकरमाइकोसिस अप टू द मॉडरेट लेवल। इफ पेशेंट इज हैविंग मॉडरेट टू सीवियर और एडवांस लेवल, तभी भी आपको आयुर्वेदिक ट्रीटमेंट देना ही है। लेकिन उसके पास से पेशेंट इज डिनाइंग टू गो फॉर एलोपैथी, उसको मुझे एलोपैथी लेना ही नहीं है, तो आप कंसेंट जरूर लेना है, और अदरवाइज लीगल प्रॉब्लम्स आ सकते हैं।
ओके सर, थैंक यू वेरी मच। और एक सवाल कुछ रहेगा डॉक्टर वंदना मैडम?
नहीं, जूम पर जो
पूछना
चाहिए वो पूछ सकते हैं। डॉक्टर संजय त्यागी सर हैं, मैडम तंडेल हैं, सोना
महेंद्र सेन, आशा जी कुछ पूछना है?
अगर कोई क्वेश्चन पूछना चाहे, दीप्ति मैम ने तो पूछ लिया। डॉक्टर मनीष,
दीप्ति,
अगर कोई क्वेश्चन नहीं है तो फिर मैम।
हाँ सर, और एक सिरावेद कर सकते हैं हम, रेगुलर जैसे रूटीन करते हैं वैसे सिरावेद करें। प्रिकॉशन,
लेकिन जलौकावचरण कब करना है वो भी मैं बोलता हूँ आपको। In Vataja condition means at the last and advanced condition, you should not use this Jalokavachar in Vataja condition, because this is a Sannipatik avastha. Kapha, Pitta and Vata and Rakta, these all doshas plays in these all mucormycosis stages. In early mild to moderate, you can have the Rakta Mokshana by external jugular or otherwise Sira Darshan है यहाँ पे, तो आप वहाँ नजदीक से सिरा से भी सिरावेद कर सकते हैं, और otherwise जलौका you can apply. लेकिन एक बात ध्यान और रखना है, आप फ्रीक्वेंटली उसको रक्तमोक्षण करना है, विद इन 2 days 4 days तुरंत रक्तमोक्षण मेनी टाइम्स करना है। बिकॉज मैंने जो बोला कि ये 2020 मैच है, पेशेंट का लाइफ का सवाल है, और हम सोचते हैं कि मेरी ट्रीटमेंट काम करेगी, अरे तब तक तो पेशेंट एडवांस स्टेज में चला जाएगा। सो जलौकावचरण प्लस अमावस्था को उसको निकालना है, और डे टू डे उसको ऑब्जर्व भी करना है। ये आपकी दृष्टि मीन्स चारों ओर चाहिए, ट्रीटमेंट अवस्था, पेशेंट बल एंड द स्टेज ऑफ द डिजीज मीन्स दुष्यम देशम बलम कालम प्रकृति मंडलम वयः, ये सब ध्यान में रखना है, ये कुछ भी छोड़ना नहीं है। देखो आचार्य ने इतने ये कंडीशंस ऐसे बता दिए हैं कि म्यूकोरस माइकोसिस में काफी फिट होता है, मींस विद इन 20 डेज ये सब के सब अप्लाई करने पड़ते हैं, अदरवाइज डेथ में आकर।
मैम आशा तंडील मैडम को आप अनम्यूट कर दीजिए, वो कुछ सवाल पूछना चाहती हैं।
किया है मैडम, पूछिए आशा मैडम पूछिए।
हाँ जी सर, वेरी ऑसम प्रेजेंटेशन। हम लोग बहुत लकी है आपका प्रेजेंटेशन इतना अच्छा सुनने मिला। सर मुझे सिर्फ यही पूछना था कि म्यूकोरमाइकोसिस को हम आयुर्वेदिक कॉन्सेप्ट से ही सिर्फ क्या क्योर और मैनेज कर सकते हैं क्या, या फिर उसके लिए एलोपैथी का ट्रीटमेंट लेना जरूरी है थोड़ा बहुत?
आपने शायद मेरा कंप्लीट प्रेजेंटेशन देखा होगा, तो मैं बोलता हूँ जो 4 केसेस मैंने जो प्रेजेंट किए उनको सबको मैंने मेरे केस पेपर के ऊपर रेफर्ड नोट्स कंप्लीट डाली है। एक बात ध्यान रखना है, क्योंकि अभी देखो म्यूकोरमाइकोसिस और आयुर्वेद की तरफ आने वाले अभी लोग काफी हो गए हैं, या वो सर्च। और मैडम ने जो पहले पूछा था कि प्रिवेंशन के लिए जो पेशेंट इतने डर गए हैं ड्यू टू द हाई मॉर्टेलिटी रेट, क्योंकि क्या होता है पेशेंट को म्यूकोरमाइकोसिस पहले पता नहीं था, लेकिन जब ये टीवी के ऊपर या ऑल अपने इसके ऊपर आ गया तो उसको ये कोविड से भी भयंकर है। 10 में से 5 लोगों की मृत्यु इसको होने वाली है। इसका इतिहास ऐसा है कि पहले जो डाटा अवेलेबल है तो 10 में से 5 पेशेंट जाते हैं। इन कोविड यू कैन हैव द डेथ रेट 2% और 1.5%, उसके कोई डरता नहीं है। लेकिन जो कंडीशन है इसमें इसलिए पब्लिक काफी अवेयर है, वैद्य भी काफी अवेयर है इसमें। ओके,
ड्यू टू द एम्पुटेशन रेट आल्सो।
हाँ यस। सो लेकिन मेरे ये 4 केसेस ने मुझे इतना सिखा दिया कि शायद अपडेट होने के बाद ऐसा लगता है मुझे कि 50 to 80% पेशेंट्स इसमें सिर्फ आयुर्वेद रोल है, मॉडर्न का कुछ रोल नहीं है, क्योंकि देयर इज ओनली वन ड्रग पोसेकनाजोल और एम्फोटेरिसिन, लाइपोसोमल एम्फोटेरिसिन बी, और विच इज हैविंग अ वेरी मच कॉस्ट। मींस अभी जो बॉम्बे से पेशेंट हमारी तरफ आ रहे हैं उसने किसी ने 30 लाख 40 लाख खर्चा किया है, किसी ने 12 लाख खर्चा किया है, किसी का बजट 25 लाख से आगे जा रहा है। मींस ऐसे जो पेशेंट है सी आफ्टर द डिब्राइडमेंट आफ्टर द एम्फोटेरिसिन बी, लेकिन उसका कोई गारंटी नहीं है इतना खर्चा करने के बाद भी। एक बात पहले ध्यान में लेना जरूरी है। और मुझे जो ये 4 पेशेंट में जो रिजल्ट मिला है तो ऐसा लगता है कि ईच एंड एवरी पेशेंट शुड बी ट्रीटेड बाय आयुर्वेदा ओनली। सो गवर्नमेंट से बात करनी जरूरी है कि दिस इज अ अमावस्था, दिस इज द सिस्टमिक ट्रीटमेंट एंड दिस इज अ वेरी सेफ ट्रीटमेंट। दुष्यम देशम बलम कालम ये वैद्य ने देखने के बाद उसका ड्रग शेड्यूल उसको करना पड़ेगा कि इसको कौन सी मात्रा में हम ये शमन चिकित्सा दे सकते हैं आफ्टर एडमिशन इन एलोपैथी और अदरवाइज इन आयुर्वेद हॉस्पिटल। वो कहाँ पे एडमिशन है, बिकॉज इट शुड बी अंडर ऑब्जर्वेशन।
सर काफी आपने बड़ा एक अच्छा प्रश्न रखा है जिस पर लगातार सभी लोग काम कर रहे हैं कि जैसे कि आयुर्वेद के ट्रीटमेंट को लेकर आपने भी प्रस्ताव रखा। बिल्कुल, तो आयुर्वेद को जिस प्रकार से अभी हम बहुत एक ऐसे ही माध्यम से, ऑनलाइन माध्यम से हम बहुत ज्यादा कुछ जागृति करने की भी कोशिश कर रहे हैं कि इस प्रकार से जो वैद्य प्रैक्टिस कर रहे हैं पूरे भारत भर में, तो उनको कुछ आगे ऑथेंटिक परमिशंस मिले, कुछ आयुर्वेद की तरफ भी देखा जाए। तो इस मामले में हर प्रकार के प्रयत्न भी चालू है। तो यहाँ पर डॉक्टर आर्शिया आपने हैंड रेज किया था, प्लीज अनम्यूट एंड आस्क योर क्वेश्चन।
यस मैम, सर मुझे पूछना था कि अगर जैसे ड्यूरिंग कोविड हो जाता है और पेशेंट को सीवियर लंग फाइब्रोसिस वगैरह है, HRCT एकदम सीवियर वगैरह है, तो वो तो कफ वातज अवस्था हो जाती है, और उसी समय अगर उसको म्यूकोरमाइकोसिस भी हो जाता है तो वो तो मोस्टली रक्त पित्तज ही होता है, तो फिर कैसे हमने चिकित्सा कैसे करनी चाहिए उसमें?
No, see, after COVID-19, the patient is वो जो is reduced, बला is reduced, and वो सब कुछ जब पेशेंट उसको देखते हैं उसका मींस जनरलाइज सिस्टमिक कंडीशन इज आल्सो द प्रॉब्लमेटिक, क्योंकि उसका जो कोमॉर्बिडिटी जो है वो बढ़ती है उसकी काफी, जो कोमॉर्बिड कंडीशन होने की वजह से उसका SpO2 लेवल भी काफी कम है। जो मैंने एक केस बताया आपको शुरू वाला फर्स्ट वाला, उसको कोविड-19 के ही सिम्टम्स इतने थे, उसको भी उसको म्यूकोरमाइकोसिस के सिम्टम्स आ गए। तो मैंने तो उसको सबसे पहले बोला कि आपको एलोपैथिक को जरूर बताना है, लेकिन मेरी ट्रीटमेंट जरूर, मैंने सबसे पहले वहां बताने का मैंने सलाह दिया है, क्योंकि अपने को अवस्था पता लगेगा आफ्टर MRI एंड CT रिपोर्ट। और जब लंग्स में भी है, फाइब्रोसिस भी है और म्यूकोरमाइकोसिस भी है, सो आपको पेशेंट को देखना जरूरी है, अवस्था को देखना जरूरी है। इट इज नॉट ओनली द इट इज लैंड इन द रक्त पित्त, इट इज वेरी मच अशुकारी इन नेचर, क्योंकि वो कितने दिन का मेहमान है ये भी पता नहीं है पेशेंट। सो और बल भी कम है तो आप रक्त मोक्षण भी काफी संभाल के लोकलाइज करना पड़ेगा आपको। सिरावेद मीन्स क्यूबैटल वेन से वो भी नहीं हो सकता है, क्योंकि उसका ओज कम है, तो रक्त और ओज का संबंध है। तो आप क्यूबैटल से भी आप सर्वाधिक रक्त मोक्षण नहीं कर सकते हो। लोकलाइज रक्त मोक्षण आप कर सकते हो इन MM केसेस, but for the COVID-19 complications, lung fibrosis and this, you should go to increase the bala, increase the oja, and plus having the treatment like this. उसमें आपको रुक्ष आमावस्था के पाचन की भी चिकित्सा देनी है। रुक्ष, तिक्त और शीत ये जो द्रव्य है जो रक्त पित्त को कम करने वाले हैं, लेकिन वो ओज भी कम करते हैं, ध्यान में रखना है। ऐसे द्रव्य आपको यूज करना है। सो यू आर इन अ पाइपलाइन, सो आपको पाइप में से इतने ही द्रव्य आपको दिखाई पड़ते हैं जो दीपन पाचन भी करते हैं, ओज भी बढ़ाते हैं और सबसे पहले बल भी बढ़ाते हैं और रसायन भी चिकित्सा करते हैं। ऐसे ड्रग्स, आपको ड्रग्स चॉइस इज वेरी इंपॉर्टेंट इन दिस, वेरी वेरी इंपॉर्टेंट।
Okay, sir. Thank you.
Any more questions, doctors, from your side? So I think thank you very much, sir. It was a great information. बहुत विस्तार से आपने बताया है। आभार तो शब्द आपके लिए कम ही होंगे, बट रियली नाइस। आपने बहुत मतलब अच्छे से पूरा पढ़ के आपने बताया है। रियली इंफॉर्मेटिव सेशन सर, थैंक यू वेरी मच। और जो विक्टोरिया स्टोरीज ऑफ आयुर्वेदा है, तो निश्चित रूप से आप इसके लिए बहुत ही ज्यादा एकदम परफेक्ट इसमें बैठते हैं कि जिस प्रकार से आपने काम किया है नेत्र रोगों में। अभी तो आजकल इस 10 साल में तो काफी प्रचलन हुआ है, शालक्य के रोग काफी आयुर्वेद प्रैक्टिस करते हैं, बट जब आपने शुरू किया तो निश्चित रूप से आपको बहुत ज्यादा स्ट्रगलिंग भी हुई होगी इस प्रकार से सब कुछ करना, शालक्य आयुर्वेद प्रैक्टिस।
आयुर्वेद के वैद्य ही पूछ रहे थे कि भाई आप शहद या कुछ घी डालेंगे तो कुछ प्रॉब्लम ना हो जाए, आयुर्वेद के वैद्य ही पूछ रहे थे। ऐसा ही शुरू में।
बिल्कुल, आगे भी कुछ हम आपसे सेशन जरूर चाहेंगे, क्योंकि ये बहुत ही आपने अनोखे तरीके से बताया, एक क्लिनिकल एक्सपेरिमेंट विद प्रेजेंटेशन। तो एक औपचारिक रूप से मैं हमारी सहयोगी वैद्य वंदना पाठक मैडम से अनुरोध करती हूँ कि आभार प्रदर्शित करें। मैडम अनम्यूट कीजिए, अनम्यूट कीजिए। अनम्यूट कीजिए, अनम्यूट। आवाज नहीं आ रही, आवाज। यस यस।
डॉक्टर हेमंत शिवाजी राव सर, आपका बहुत ही अच्छा आज वक्तव्य रहा और हम लोगों ने केस प्रेजेंटेशंस भी साक्षात देख लिए। इतनी दूर बैठे हुए हम आपके पास क्लिनिक में आपके पहुंच गए। आपने भी ऑनलाइन पेशेंट से जुड़ के किस तरह करके हम लोगों को ये केसेस दिखाए, और हम लोगों के जो बहुत सारे लोग हैं जो डरे हुए हैं, मुझे लगता है कि म्यूकोरमाइकोसिस का आयुर्वेदा में ट्रीटमेंट मौजूद है और अभी आप मुझे लगता है और ज़्यादा इसमें वर्क करने वाले हैं, और हमारे लोगों के सामने फिर दोबारा से एक बार आप और सारे प्रेजेंटेशंस के साथ आएंगे तो हम लोगों को बहुत अच्छा लगेगा। आपके जितने भी वक्तव्य में बहुत सारी आपने चीज़ें प्रिवेंशन के तौर पे भी बताई, तो वो हमारी जो देश विदेश से बहुत सारे लोग बाद में देखते हैं। अभी जूम पे जो जुड़े हुए डॉक्टर्स हैं, उनके अलावा वैद्यों के अलावा बाद में बहुत सारे फैन फॉलोअर्स हैं आयुष दर्पण के, वो भी सब देखते हैं, क्योंकि ये इतना बर्निंग है इस समय म्यूकोरमाइकोसिस और वो भी आइज का। तो आपने निश्चित रूप से बहुत ही अच्छा वक्तव्य दिया आयुष दर्पण की पूरी टीम की ओर से, और हम सभी जुड़े जितने भी वैद्य हैं समय, दीप्ति मैम, अरविंद सक्सेना सर, वो अभी देर से ही आए हैं मुझे लग रहा है, और अंजना सक्सेना मैम, अर्शिया मैम, मनीषा मैम, शेटा मैम, आशा टंडेल मैम, उषा होला मैम, सोनल पटेल मैम, रेखा सिंह मैम, कैलाश कुमार जी, BL मेहरा जी, सबकी ओर से आपको बहुत बहुत धन्यवाद, और पूरे आयुष दर्पण की टीम, नवीन जोशी सर, सबकी ओर से धन्यवाद।
मैडम, आपने भी मुझे एक प्लेटफॉर्म दिया, जितने अनुभव हुए मुझे शेयर करने का मौका मिला। मुझे स्लाइड्स और ये सब प्रेजेंटेशन में काफी गड़बड़ हो गई थी,
नहीं,
तो
नहीं,
ये जो है वो जितना अच्छा हो सके उतना मैंने प्रयत्न किया है, और भी काफी बातें हैं जो विस्तार से हो सकती है। धन्यवाद।
बिल्कुल बिल्कुल सर, थैंक यू वेरी मच सर, थैंक यू, फिर मिलेंगे सर निश्चित। थैंक यू ऑल द डॉक्टर्स, थैंक यू।